Hello, and welcome to the UC San Diego Lung Transplant Program. We thank you for entrusting us with your care. My name is Kamyar Afshar, and I will be discussing how your immune system will react to newly transplanted lungs and risks for rejection. Your immune system has the ability to differentiate between self and non-self molecules that belong to bacteria, fungi, and viruses. Although the newly transplanted lungs are from human cells, the donor lungs are considered non-self by the recipient immune system. This results in a direct attack on the newly transplanted lungs, known as rejection. You will have to take lifelong anti-rejection medications to reduce these attacks by your immune system in order to reduce rejection episodes. Even though your immune levels will be purposely reduced with the anti-rejection medicines, rest assured it will be high enough to reduce the chances of you having serious infections. You will be monitored routinely to make sure you are tolerating your medication based on your lab values and be closely evaluated for signs and symptoms suggestive of infection or rejection. Some common factors can make it more likely to develop rejection. These include injury to the donor lungs immediately after lung transplant surgery, not taking your anti-rejection medicines regularly, not following the treatment plans set for you, contracting certain lung infections, and even gastroesophageal reflux disease. Here are a couple of ways we monitor for the clinical detection of rejection. First, we rely on you and your caregivers to report symptoms. Symptoms may include cough, shortness of breath, chest tightness, and even fevers. Second, we review your lung function on a regular basis with use of spirometry and look for changes on chest X-ray or CT scan. If you have one or more of these signs or symptoms, we will recommend undergoing a bronchoscopy to look at your airways and get samples for detection of infection and reversible rejection. Unfortunately, rejection can also happen without any signs or symptoms, known as asymptomatic rejection. Here at UC San Diego, we perform surveillance bronchoscopies with tissue biopsies at regular intervals to better tailor your care and minimize the risks of reversible and irreversible rejections. There are different kinds of rejection. Acute cellular rejection is caused by the direct response of your immune cells to the transplanted lungs. This type of rejection is reversible and is treated with varying doses of steroids. The other type of reversible rejection is due to antibodies released from defense cells and is called antibody-mediated rejection. The treatment for this kind of rejection is based on removing the harmful antibodies and reduce future production. Plasmapheresis is the name for the procedure that removes the antibodies directly from your bloodstream. Treatments directed at reducing antibody production include intravenous injection of a protein called immunoglobulin G and medications that reduce antibody production like rituximab or bortezomib. A lung transplant recipient can have multiple episodes of acute reversible rejection over time, in turn increasing the risk of developing chronic irreversible rejection. Chronic irreversible rejection is usually diagnosed by pulmonary function testing in combination with CT scans. Rest assured that we are always monitoring for reversible rejections and making attempts to reduce chronic irreversible rejection with every visit. Usually with chronic rejection, there is a progressive worsening of lung function and symptoms over time. Hence, it is important to make every effort to have reliable and regular spirometry performed. Treatments recommended for chronic rejection include changes to the maintenance immunosuppression doses and levels, adding new medications that will strongly inhibit your immune cells such as thymoglobulin or alemtuzumab, a procedure called photopheresis, and in select cases, even another lung transplant. Photopheresis is a medical procedure in which your blood is collected into a specialized machine that separates your white blood cells from the other blood components. The other blood components are returned to your body immediately, while the separated white blood cells are retreated with a medication that makes them sensitive to ultraviolet light, and then returned to your body. This process may help in regulating the white blood cells, thereby stabilizing your lung function and lessen worsening of chronic rejection. I hope you found this brief overview of lung transplant rejection helpful. Please speak with your doctor if you have any questions regarding this topic, as every case is different. Thank you for joining us.